A very good afternoon, everyone. Today I am here with two separate cases of subhyaloid hemorrhage in two young lads who presented with subhyaloid bleed following attending a festivity with very large, very loud DJ sound for a prolonged period of time. The first case is of a 16-year-old who had sudden loss of vision following this same case, that is loud sound exposure. The vision was hand movements. There was no history of any trauma or systemic illness. This was the fundus picture, where we can see a large subhyaloid bleed about 3 disc diameter in size, which has the typical double ring appearance along with the exclamation mark. On doing serial OCT, we were able to discern the site of the bleed that was subhyaloid in nature. Because it was a very fresh bleed, we opted for an ND-AG hyaloidectomy away from the macula, which led to immediate draining of blood inferiorly. This was the status of the patient post 1 month. We can see the empty cavity along with some inner retinal layer damage as well because of the strong laser. The vision was good. It was 6/6 in right eye. Case 2 is of a 20-year-old presented with similar history. The best corrected vision was 1/60. We treated the patient with C3F8 and face down positioning. But 1 week later, the patient had dispersed hemorrhage with only PL plus vision. We wanted the patient to have a good vision earlier, so we went for a vitrectomy. This was the post-op picture. There were some irregularities of the inner retinal layers, which is seen 7 days post-op. Post 1 month and post 2nd month, the retinal anatomy was well restored. Now, putting on a thinking cap, we thought what could be the other cause in this case. There was no history of any Valsalva or any breathing disorder, breathing exercises being done. The cardiology evaluation came out to be normal. There were no bleeding disorder, no history of any trauma, and no other retinal disorder in the same eye or in the other eye as well. Only questions remain, could it be a case of a laser light retinopathy? But then again, why only 1 case per event? And then also, many people should have been affected if it was due to a faulty laser. The patients also agreed that there was no laser light involved in the festivity. Now, normal conversation is around 60 decibels, traffic sounds are 80 decibels, but very large loud sound at a rock concert or such DJ sounds at a festivity, it will be around 120 to 140 decibel. So I believe that this could be due to a one-time exposure to an intense impulse sound. High decibels can cause a transient high blood pressure, leading to a vascular blowout, secondary to this intravascular pressure rise. There have been reports of subhyaloid hemorrhage when there was accidental exposure of laser light, where 34 eyes were simultaneously affected. Indian festivities rely heavily on this loud music and laser sounds, but reports on any loud sound causing a vascular damage like a subhyaloid bleed is missing. There have been reports of stroke and CVA caused due to loud traffic sounds. Such incidents need reporting to determine the safe limits of how much sound we can expose ourselves, the distance we can keep from the sound box, and the time period for which such kind of exposure can lead to such bleeds. Aberrant use of recreational lasers and high decibel sounds need monitoring, public awareness, as well as government regulations. Thank you.
Nice. Thank you for doing it within the allotted time. So we can go to the audience if they have any doubts. Anybody wants to ask any question to the speaker? So I had a few doubts to ask you in the meantime. So first thing you said it is sound related. And second, we are going to say that it is a subhyaloid hemorrhage. So do you think it was the same case for the second case? The sound could lead to a bleed just at the fovea.
So we had that because the patient gave the same kind of history, that the night before they had attended a barat with a very loud music, and they agreed that they were standing very close to the sound box for about 2 to 3 hours.
Okay. And were there no history of laser light exposure at the events?
They were saying no. And
Okay.
I also found out from government regulations that they cannot use the damaging laser light at the festivity. But again, the case report that I had shown that 34 eyes were affected,
Yeah.
the laser light component was affected in that case.
Yeah, because all the previous reports, they said it was due to a laser light shining in the eye. The patients reported a sudden flash and a blackout, followed by, when they went to the ophthalmologist, they had these bleeds. So it might be related more to the laser light exposure than to the sound. The second instance, the subhyaloid hemorrhage, are you sure about the location of it? Because in the second case, it was
It looked
looking
like a sub-ILM bleed. Yes,
and in the first case, there were other signs to also indicate the sub-ILM location.
Actually, the exclamation mark and double ring sign.
Yeah.
But when I did the serial OCT, it was like the retinal layers are all intact, and above that, the subhyaloid bleed.
Yeah, so it is very difficult to make out whether you are in the sub-ILM space or whether it is the subhyaloid space.
I read
So
a
on-
lot of papers for that, but
Yeah, so on
it's
the
very
OCT,
confusing
what you
actually.
can do is try to trace whether you can see the posterior hyaloid. If you are seeing the hyaloid as well as the ILM as a two layer, that is also known as a double layer
Yeah, so these
sign.
young age patients, hyaloid visibility was very difficult
That's
because
true, I agree with you.
That's
But it might be a case of more of sub-ILM hemorrhage because not all boat-shaped bleeds are sub-hyaloid. So these sub-ILM hemorrhages, you can inadvertently go and hit the laser thinking that it's the posterior hyaloid, but you might damage the underlying retina. Whereas it was safe in this case, no issues occurred, but you have to be careful in the next cases.
Thank you.